Hi, everyone. My name is Liz Hall, and I'm a division director with the American Lung Association. I'm so excited and glad that you've been able to be part of this KNOW VAPE educational series. I really want to thank Idaho Public Television, and in particular, Carrie Wardle and Jenny Sue Weltner for bringing this to life for all of us. It has been a wonderful experience to be part of this and to see all of the education that's been provided. I know at times it's probably a lot to take in. Thankfully, with this being recorded, you'll be able to go back and revisit and take a look again at anything you'd like to. I think one of the big concerns coming out of this may be that feeling of, okay, I know a lot more, but I don't necessarily know what to do next. Schools are already strapped. People are working as hard as they can, wearing multiple hats. I just want you to know, first and foremost, you're not alone. We are here to help you have partners. So I want to talk to you in particular about the support that the American Lung Association in partnership with Project Filter can offer. This is available to a total of 20 schools across the state of Idaho this year. And I'm going to talk to you just briefly about what that support is. And it's something you could consider, but it's certainly open to anyone participating in this call and who's part of the Idaho public education system. So the slide you're looking at says, end the epidemic. That's what this project we're working on, and the tools and resources we have to share is all about. We want to create that healthier tobacco and vape-free future for all of Idaho's kids. This project is really about building capacity for sustainable youth vaping and tobacco intervention and alternative to cessation, as well as youth tobacco cessation. Did I say intervention? Intervention, alternative to suspension, and youth tobacco cessation in Idaho schools. As I mentioned, it's a partnership with Project Filter, but it really is all about serving you, who are serving all of our kids every day in everything you do. So what kind of support is available through this project? We have training available at no cost. We've got planning tools that can help you take a look at your particular situation and decide what to do next. We have implementation packages so that you can bring the changes you need to your school with everything you need to make those changes, as well as stipends for people that offer programs, because we know it takes time and it takes energy. And even though you have a passion for helping youth and for helping students, sometimes it's just nice to have a little bit of a thank you at the end. And that's what that stipend is designed to offer you. So how can this project, this partnership with Project Filter and the American Lung Association, benefit you and your school and all the students and families you serve? Let's talk about that. In terms of really making a difference with youth tobacco use, the single most important thing you can do is have a really good policy in place. Thankfully, Project Filter can help you with policy change resources, but I will tell you, every single person that steps on a school campus is affected by that school's tobacco and nicotine-free campus policy. Everyone. It's the only thing you can do that can help and protect every person that walks onto your campus. That's why it's so important. So have a look at your policy. Think about updating it. I tell you, I look at policies in Alaska frequently. I just finished one this past weekend. And there's so much you can do to provide a really good and healthy environment. So I encourage you, if you haven't looked at your policy in a while, take a look at it. In terms of students, moving up our pyramid, right? From the big base of policy change to prevention. How do we really keep kids from picking up that first tobacco product, that vape? There's an evidence-based program out there. It's not mine. So you know, if I'm talking about it, it must be great. It's Catch My Breath. It's wonderful. And a number of schools across the state are using this program, and it's very effective. It really does catch kids. It really does help kids understand tobacco better and make better choices. And by the way, when I say tobacco, I'm referring only to commercial tobacco. We're not talking about sacred or ceremonial use of tobacco. And when I use the term tobacco, I mean all tobacco products, because let's face it, vaping's the big thing on school campuses right now. And Catch can help with any type of tobacco product issue you may be having. Unfortunately, even if you run a great program that reaches most of your kids, you're still going to have a few that fall through the cracks. What do you do with them? Well, for a lot of schools, we've cited them, we've suspended them, and boy, that's not really working. And that's because we're trying to get kids to make a behavior change by using a punitive approach. Maybe we need a behavior change solution to address this behavior change problem. And that's where we could use an intervention, another resource, a way to provide education, to step alongside a student and give them information, because we all know the voice right now that's loudest to a lot of these kids is the voice of people who are marketing these products in TV shows, movies. My goodness, you turn around and it's being marketed. TikTok, all that stuff. So you need that chance to talk to these kids, and intervention's the time to do it when they've been caught. So out of those kids that you provide that intervention program for, those kids who've been caught using these products on campus, you need a cessation alternative, right? Because some of them are going to want to quit. We have an evidence-based program called Not on Tobacco. And we can train people in this program and help them be ready to help kids quit. So this project I'm working on with Project Filter is focused on intervention and cessation, those top two pieces on the pyramid that we've talked through. So to bring intervention or an alternative to suspension and a cessation program to life in your school, man, you're going to need support. You're going to need materials for students. You're going to need materials for people running the program. And we can offer all of that support and at no cost to you. The training's going to be free. These kits are going to be free. Beyond that, we want to provide you support. How do you run these programs? We can provide you orientations, walk you through these programs and help you understand how to introduce important concepts to middle schoolers versus high schoolers, to kids who may not be native English speakers and who need some additional support. We can talk through all of that. So, as I mentioned, we have orientations. We'll have opportunities to gather facilitators together and talk through any concerns they may be having with implementing the programs. In the meantime, we do have this resource-rich website with lots of information and tools. It's designed to support students, their families, and the schools that they study in. So I just want you to know that these resources are out and available to you. This is part of the solution. We want to be part of your solution. So if this is something that may be of interest to you, reach out to me. There's my email, there's my phone number. Love to be another partner with you in addressing these issues. And I, again, want to thank Idaho Public Television for the opportunity to talk to you today. I just want you to know that I wish you all the best in moving forward. If you need anything from me, you have my email, liz.hall@lung.org. Just reach out. Thanks for your time. And again, all the best, everyone.